if my patient has TCM blood deficiency, are they anemic? And when I see anemic patients, do they automatically have TCM blood deficiency? That is a common question that I get from my students. And today I am going to answer it. Plus, we're going to look specifically at one of the most common patterns seen in clinics, specifically in women, blood deficiency. We're going to look at the causes, the consequences if it's not treated, the symptoms, and the treatment, including acupuncture points, herbal formulas, and TCM nutrition. And stay till the end because I have a little hack that I use in clinic to make sure that we really tap into nourishing blood and helping the patients when they are affected by this common pattern. Welcome back to my channel. If it's your first time here, I'm Clara from AcuPro Academy, and I create Chinese medicine and acupuncture content for students and practitioners, making it easy to grasp and fun to learn. Let's go. So before we start looking at blood deficiency, I'd like for us to go back to foundation, because if we don't understand or we have a hard time with our diagnosis or a treatment plan, we need to go back to foundation to be able to really grasp the concept of blood deficiency according to TCM. So let's review blood in Chinese medicine theory. How do we get blood? Our postnatal blood in TCM is produced by the spleen and the stomach, transforming food into nutrients. For example, taking in iron and other minerals through the food in order to produce blood. Our prenatal blood comes from our parents, which is our blood type, like type A, type O, type B, type AB. Basically, in TCM, it comes from kidney essence, which produces marrow, then in turn contributes to blood formation. And finally, blood is formed in the heart. This is the TCM picture about blood formation. Blood function, according to Chinese medicine, is to nourish tissues, muscles, skin, hair, and nails, anchors the spirit or calms the mind, because blood is said to be the material basis of the mind for all mental activities. So if there's issue with mental health, we have to look at blood. Now, there's a relationship between qi and blood in TCM. Blood is said to be the mother of qi, and qi is in charge of moving blood because blood is a substance. It's part of the four vital substances, so it's matter, while qi is energy. And of course, blood supports menstruation and fertility. Now, when we look at the yin organ, they're all involved in blood. Heart moves blood. Spleen produces blood with the stomach, transforming nutrients. Liver stores blood for menstruation. Lung disperses and distributes it all over the body. And kidney, of course, assists its production through bone marrow. Having said that, the organs that can be affected by blood deficiency are going to be spleen, liver, and heart. What are the causes of blood deficiency? Think about it. If spleen is not nourished properly, so diet can be a cause, then it can become spleen qi deficient. If spleen qi is deficient, it's fatigue, it's weak, it cannot produce blood because it doesn't have enough nutrients, for example. So diet is number one in having blood deficiency. Number two is blood loss. If a woman bleeds every month really heavily for, let's say, 5 to 7 days, she will become TCM blood deficient. And in the Western world, she might also become anemic. We're going to answer that question in a minute. But first, let's finish with the causes. Overworked or mental activity that's straining the body. For example, years of anxiety, overthinking, worrying, overstudying. If you're a student and you're in school for 3 years, 4 or 5, I did a doctorate in TCM. I was in there for 5 years full time. Let me tell you that yes, it is very, very straining on the mental health and it's exhausting. And yes, blood can become deficient because remember, blood is the material basis of the mind. So mental activity or overworked with mental work can definitely deplete blood in TCM. Certain chronic illness can also create blood deficiency, and trauma, if someone has had a car accident and they bled a lot, obviously, or post-birth, there could be hemorrhage as well, which cause blood deficiency. Those are the main causes, not exclusive, but those are the ones we see most common in clinic. Before we start looking at the symptoms, the consequences, and the treatment for blood deficiency, I'd like to share a story with you that illustrates my point. At one point in my 40s, I burnt out. I had just finished 5 years in school while working full-time. I started a practice. Then, a few years later, I opened my own multidisciplinary clinic, which I had to manage and run while having a full-time practice while teaching at 2 colleges in Vancouver. I was burned out. I thought I could do it all. I was superwoman, like a lot of us think. And eventually, one day I went to work and there's a few steps to get to my clinic. And I could barely take those few steps. I was like, I couldn't breathe. Hiking is one of my favorite things to do. And we went hiking one day and my husband was like, what's going on? You're so slow. And I'm like, I can't breathe. It is too hard. I don't feel good. I feel dizzy. I had to sit down and he's like, what's going on with you? So we went to do a blood test. And guess what? My ferritin levels were 4. 4. So if you're not familiar with ferritin levels, anything under 9 is life-threatening. I could have dropped dead of a heart attack because I didn't have enough ferritin pumping through my blood. Anything above 9 up to like 20, 25 is definitely not good. It's very low. But underneath 9, mine was 4. So I did not take any iron supplement. I was sent right away to get iron infusion. I had to. And I had a bag of infusion for 2 hours. And when we tested 3 weeks later, my number went up to 122. I literally felt a change and a shift in my energy within a few days. It was like a miracle. How did I get so low? This is what we just talked about, the mental activity, the overwork, the overworry, the overthinking. I worked so much mentally that my body broke down from the burnout. We see this a lot in practice. So I wanted to make sure you can educate your patients and tell them that yes, from overworking, we can run our body to the ground, which in Western world, they would say your cortisol level, your adrenals have been depleted, right? So that in our mind, we think, oh, that's a kidney deficiency. Well, actually, adrenal that is low or adrenal fatigue is actually a spleen Qi deficiency in TCM, which makes sense because if we overthink, overwork mentally, we utilize our spleen Qi and it gets depleted and then it can't produce blood. And so then we get blood deficiency. Does that all make sense? Now let's look at blood deficiency symptoms. It is always P and P, pale and poor. Pale lips, pale tongue, pale nails, pale face. Poor sleep, meaning cannot fall asleep easily. Poor energy, meaning fatigue. Poor digestion, poor memory, poor focus, poor concentration, poor vision. Remember, the only organs that can be blood deficient in TCM are the heart, the liver, and the spleen. So let's differentiate the symptoms for all 3. Spleen blood deficiency comes from spleen Qi deficiency with pale lips, weight loss or very skinny, poor appetite or no appetite, bruises easily, fatigue, and a pale tongue. For liver blood deficiency, remember, liver in TCM theory opens into the eyes and manifests on the nails. So we're going to have pale nails, blurred vision, floaters, spots, dizziness, and then we're going to have scanty menstruation and numbness and tingling of the extremities because not enough blood reaches the extremities. With heart blood deficiency, remember blood in Chinese medicine theory opens into the tongue and manifests on the face. So we have a pale face, a pale tongue, of course, poor sleep, cannot fall asleep easily, poor memory, poor focus, poor concentration, and since the heart is in charge of blood circulation, we're going to have poor blood circulation. That's how we differentiate all 3. Now, let me show you what happens when we don't address the blood deficiency, the consequences. This is really key because if you see someone in clinic with yin deficiency, it might come from a blood deficiency. Remember, blood is yin in nature, and when there's not enough blood, there is not enough yin, there is not enough liquid, so things start to dry. So we get yin deficiency as the next pattern. This is very common for liver blood deficiency, leading to yin deficiency. The next one is blood stasis. What's the connection between blood deficiency and blood stasis? When there is not enough blood, think of a river going down a mountain. When the river starts to dry, what's left is pools of water along the river on the way down the mountain. That's blood stasis, and that water just stays there and it's not moving. That is the blood stasis. So when there's blood deficiency, there's not enough blood. So it's kind of going to pool. And so often we're going to have blood stasis as the next pattern. And that could happen with liver blood deficiency, with scanty menstruation, and now we're going to have clots in the blood and maybe cramps. Does that make sense? Okay. The third consequences of blood deficiency is wind. Liver wind. We're not talking about external pathogen wind. We're talking about internal liver wind. How do we get liver wind? Either from liver blood deficiency, liver yin deficiency, liver yang rising, liver fire. So remember, wind in theory is related to the spring, to the liver and the gallbladder, and the wood element. Yes? Okay. Therefore, internal wind always comes from a liver pattern. And internal wind is all about movement, like twitches and tics and spasm, right? So liver blood deficiency, usually we're going to have this eye twitch that feels like, oh, it's so annoying. I have this eye twitch. That's usually a blood deficiency. Also tingling, pins and needles. That is also a blood deficiency leading to internal liver wind. If you're still struggling with TCM diagnosis or the theory like we just depicted here with blood deficiency, my book, Chinese Medicine Made Easy, my green book, is perfect for you. If you don't have your copy yet, I'll have the link for you below. It goes through all the theories and all the diagnosis, and it comes with my fillable intake form you can use with your patients every single time. Okay, so now let's talk about treatment. How do we address blood deficiency? We're going to start with acupuncture. When you are selecting your points, always remember, first treat the root, which is the blood deficiency, which is your pattern, then add up points for the symptoms that are specific to that person. Yes? First, let's pick the basic points that work for any blood deficiency, no matter what organ is affected. Stomach 36 is the only point that actually tonify qi and blood. So it has to be there. Spleen 6 nourishes blood, and it's also nourishing spleen qi. And because spleen qi creates blood, we have to do spleen 6, right? Plus, it's the crossing point of liver, spleen, and kidney, which really is going to be a great point, specifically if it's affecting the reproductive system, the digestive system, or the mental health, which if there's blood deficiency, pretty much that's a good bet. Yes? Those 2 points have to be there. If it's a liver blood deficiency, we'll add up liver 8. If it's a spleen blood deficiency, we'll add up spleen 4. If it's a heart blood deficiency, heart 7 is your best bet. And the last point you could add is bladder 17, the back shoe point of blood. So good. Now that we have all our acupuncture points, let's answer that question I had at the beginning. When someone is anemic in the Western sense, they have anemia like I did when my iron and ferritin level was 4. When someone is anemic, are they automatically TCM blood deficient? Not always. They could be yang deficient, they could be qi deficient, and they could be blood deficient. If someone is TCM blood deficient, are they automatically anemic? Not always. The best answer in TCM with every question, it depends. So yes, when we see anemia, we cannot say for sure that is a TCM blood deficiency and vice versa. We always have to do a TCM diagnosis per each unique patient. Now, let's look at formula. I love Chinese herbal formulas. Specifically when it comes to blood deficiency, they're very powerful and very useful. However, if you don't do herbs, then please do not prescribe them because they have side effects. If you're doing herbs, then let me tell you, my 3 favorite herbal formulas for blood deficiency are Se Wu Tong. Se means 4, so there's only 4 ingredients. Se Wu Tong is going to be your best bet when there is heart and liver blood deficiency. Heart and liver blood deficiency would look like pale tongue, fatigue, poor memory, poor sleep, pale face, pale nails, and blurred vision, sea spots, maybe floaters, and maybe dizziness, scanty menstruation. Now, Sewutong is also moving because it has moving herbs in there like Xuanchong. So because it's moving, we have to be careful. If we need to move because there's a tendency towards blood stasis, then that's a great formula. But if we don't want to move, let's say there's heavy menstruation, we probably wouldn't give that formula. We probably would give the second one. So Bajantong, the next one, Ba means 8, so there's 8 ingredients in that one, is a much better formula when there's liver and spleen blood deficiency. Liver and spleen blood deficiency would look more like a spleen Qi deficiency with fatigue, digestion issues, but then also liver would be affected, so some scanty menstruation, maybe some dizziness, poor focus, poor concentration, that comes from the spleen, overworked, overdone. Bajantong is a really perfect formula for women specifically, I would say. Not that you can't give it to men, but in practice, this is a very often given to women. And the last one is Guipitong. Guipitong is when there is heart and spleen blood deficiency. Heart and spleen blood deficiency would be a lot of anxiety, difficulty in falling asleep, feeling fatigue, weak digestion, poor circulation. That is the best formula. Gui means nourish and Pi means spleen. This is a really good formula to nourish the spleen and the heart, specifically when mental health is affected. So those are the 3 main Chinese herbal formulas for blood deficiency. There are many more, but those are very common and they are very effective. Now, let's look at nutrition. From a TCM perspective, when there is blood deficiency, we need to nourish this blood with red, purplish kind of food. So beet soup. If you've never had borscht, borscht is really good for blood deficiency. It combines beets and purple cabbage. Very good for that. We can also add berries, cherries, and moderate amount of red meat. We want to have stews and soups and warm food. We want to make it easy on the spleen to stay strong to produce the blood. We want to support the spleen, so we don't want to have a lot of raw food or cold drinks. Other food to incorporate are dried dates and figs. Eggs are great. Bone broth is good too to support the spleen. This all going to help when it comes to blood deficiency. If you haven't invested in my Chinese medicine treatments made easy book yet, let me tell you, it is a fantastic resource in practice. I have put my years of experience and clinical pearl into a guide that is easy, clear, and covers over 160 syndromes with common patterns, acupuncture points, formula, nutrition, ear points, and so much more. You will also have blood deficiency treatment in there, Qi deficiency, liver Qi stagnation, liver yang rising, all the common patterns on top of the syndrome. If you haven't watched my video on spleen Qi deficiency, the causes, the consequences, and the treatment, similar to what we're talking here with blood deficiency, I'll have the link for you in the show notes below. This pattern we see so much in practice responds really well to Chinese medicine, acupuncture, nutrition, and herbal formulas. But one of the hacks I wanted to share with you is using the 8 extra vessels to nourish blood according to TCM. If you haven't seen my 8 extra vessel video to understand how we utilize them in clinical practice, I'll have the link for you below because it's very useful and it's going to help you understand how to tap in those amazing 8 vessels. So for the blood deficiency, one of the things that I do all the time is I do spleen 4 on the right side and pericardium 6 on the left side. This allows to tap into the Chong vessel and open the Chong vessel. And what is the Chong vessel? It's called the sea of blood. So it's really going to help us when there's blood deficiency. So spleen 4 on the right, pericardium 6 on the left. The pericardium 6 is the confluent point of the yin wei vessel, and spleen 4 is the confluent point of the Chong vessel. Together, they will help in nourishing blood and increasing energy. I use this during pregnancy, fertility, perimenopause, all the time if there is blood deficiency. It's a very powerful combo. I hope this was beneficial and you really felt connected to blood deficiency, how it comes about, the causes, the consequences, and how we treat it in practice. Every day I'm humbled by the amount of love I receive from everyone in this amazing TCM communities. The rock stars out there are unbelievable. I get DMs, emails, comments with so much love. I'm going to read you one because they all make my day. I can't share them all, but here's one. Clara, I want to say you are doing so much for us TCM students. I love all your content. I'm catching up and still going through everything you provide us. Recently started finding a way to incorporate the podcast in my routine. Please don't stop what you're doing. It is an amazing legacy you are creating. You are making a huge mark on the TCM world. There isn't a TCM student in my school who doesn't know who you are. Please, please, please keep up all your hard work and thank you for sharing all your knowledge. It helps us so much. I hope to become a great practitioner myself and know you will be part of the reason why I'm able to help my patients. Love your energy, love all that you do. Thank you a million times over. This is why I continue to spend hours creating content and supporting everyone in this beautiful TCM community. So thank you, thank you, thank you. Watch this video next, and no matter what, keep rocking it using TCM because after all, acupuncture rocks!